Good afternoon, everyone. Welcome to the latest AUA webinar, AI-powered efficiency in urology. My name is Brandon Theophilus. I'm with NextGen Healthcare. I'm the general manager of our specialty care business unit at NextGen. I'm delighted to have with me my dear friend Saemica Wilkins. Saemica has most recently been the Chief Operating Officer at Associated Urologists of North Carolina, dominant group in the Raleigh-Durham area, but has a long history leading and driving change in ambulatory health clinics, primarily in the North Carolina area. As we talked about in the title of the slide, we're going to drive into something that has been quite the hot topic as I meet with practices around the country, and that's AI and the innovation of AI and its impact upon specifically urology practices. But before we get there, allow me, if I could, just to introduce a little bit about NextGen. If you're not familiar, we've been in this business of electronic health records, practice management for a really long time. We are dedicated exclusively to ambulatory practices, meaning we do not have an acute care or hospital platform that would compete against an Epic or a Cerner. And as such, we're an extremely relevant player in the ambulatory space. Today, there are over 100,000 physicians that are documenting in the NextGen system, and they're located in north of 65,000 practice sites across this country with an active patient database of give or take roughly 100 million patients, so a significant portion of the U.S. population. NextGen Specialty Care, the business that I get the pleasure to run, is a part of NextGen that is specifically focused on a select identified group of medical specialties, obviously urology being one of them. That starts obviously with purpose-built, very specialty-tuned clinical workflows. In the case of NextGen, it's the NextGen Urology Suite, but goes far beyond that to include a team of subject matter experts, meaning folks who truly understand the everyday ins and outs of a urology practice. They're there to work with our clients through the deployment of the software, but most importantly, beyond the go-live date, in helping to support that software, continue to innovate on that software, so on and so forth. This is an awful challenging business that we are all in, that business of healthcare. I'm sharing with you just a few of those challenges that I suspect many of you perhaps discuss behind your own closed doors of a boardroom or leadership meeting, and or hear about from the patients you serve every day. We're going to talk through how we at NextGen are helping our clients solve for many of these challenges through the use of technology and automation and AI. But it runs the gamut, as I'm sharing with you in front. Patients and the patients as a consumer, and patients demanding that they be not only communicated with, but communicated often in the means with which they desire, what we call omni-channel communication, and that's reaching patients via email, text message, phone, so on and so forth. Physicians and dealing with the burden of documenting in a computer system. So delighted to share a little bit, and we'll talk some more. Saemica can share some real world experience around the success of leveraging AI around physician documentation. And all of these things, which are all important and become truly the new imperative that we at NextGen think about every single day, are all kind of then anchored for us with how we operate within that middle bucket. And that's several fold. One, recognizing the complexity of all this technology. I realize that I am a part of what for many is considered to be the necessary evil. But at the same time, I truly believe, and we are now seeing, that technology can truly empower, embolden, and help a practice thrive. But it's only as good as how well all of it integrates and operates together. So hear loud and clear from so many physicians, practice leaders around all of these disparate technology solutions that they are using today, but not very many of them in some instances are talking well to each other. So what we'll share more about this here in a little bit, but truly sort of our heartbeat at NextGen is around making sure when we add new technologies and new solutions, ensuring that they are not only the right solutions, but that those solutions are truly fully integrated. And that is one of our bellwethers. It's the integration of the NextGen platform. So without further ado, now it's time for me to bring in my friend Saemica, and we're going to start to talk about what we've defined as those themes and challenges, some of which I just shared with you on the prior screen. But now we identify as what we're calling the 7 layers of efficiency. And there's a lot here. We're not going to unpack all of this, but my goal for today is to hopefully be able to at least help shape some of the conversations that you're having, and or shed some light on maybe some things that you all have been hearing about. And so, Saemica, hopefully you're with us here now. We're going to start to talk about these levers.
Absolutely.
Yeah.
I think I will start by saying why we actually labeled this as 7 levers. Back in 2021, when AI first started like really surfacing, everyone thought, oh, this is futuristic. I think now we're in that place where we are being moved and pried to adopt these new changes within AI technology or automations. The first lever that we have listed is revenue cycle uplift. Every healthcare operation manager, revenue cycle, physicians, this is your pet peeve. Because what you're seeing now is you will send out a clean claim or a claim that you've consistently done, services that you've done for years and years. So you feel that you know how to adequately document these services. Now the insurance, the payers are now utilizing AI technology. This AI technology is not allowing you to get fair service on first glance. It's getting a denial. So you have to leverage AI in order to level the playing field again, so that you will be able to get your clean claims back out by doing exactly what the payers have done. Leveraging AI offers you several things in revenue cycle. The opportunity to have a system that will check for prior authorizations. It runs and checks for prior authorizations, checking eligibility. And you're also able to even adopt, because now with larger procedures now, in-office procedures, more specifically, they are requiring documentation prior to even paying out a claim. So you can leverage that system to check all of those things for you. And in addition, attach your clinic note.
In addition to all of that, something, Saemica, that we've seen an awful lot of success and plays a very large part in helping to increase that gross profit is the use of our intelligent rules engine, and being able to scrub those claims before those claims even go out, and leveraging the intelligence that comes with not only our relevance in this instance, the urology space, but then it starts to learn the patterns within that actual practice of your own.
Yeah. I would piggyback on that. One thing that I've in this market now, where you have new physicians coming into the market, they're not coders. They're physicians. They do not know the modifiers and codes that are inclusive of another. So this is when this AI technology and those robots now will be able to say, oh, this needs a modifier, and add that appropriate modifier to assist our providers with this type of matter, because this is something that they will learn over time. But initially, you want to get the maximum reimbursement, and make sure that you're able to not get a denial because it needs to come back for a modifier to be added. The second lever I will tell you is it's one of the most important ones because this is how it's talking about referrals and how we keep referrals in an automation system for closing the loop, whereas that's most important. But the biggest piece of this that I think we take for granted is retention. So this gives us patient satisfaction by your patients now. You're communicating with that primary care physician that's referring to you. They can see a closed loop, the reports in, we've scheduled the patient. They can see the patient's been, if the patient missed an appointment and if we've, rescheduled this appointment. So it prevents us from losing patients. One thing that I always tell my staff is a lost patient is not just a lost patient because we've missed the opportunity for care. That's also lost revenue. So this right here is a way of us to be able to keep up with that and track it. And it also offers your patients to be able to have a sense in their care. Most people are busy. They're working throughout the day. They can actually schedule themselves, which is what we call auto scheduling. Those type things make sure that we can keep everything within one platform and allow us not to miss those type of patients.
Yeah. So I perhaps should have mentioned this at the onset. This time that Saemica and I have with all of you, either today live or on demand after we're done, is not in any way going to be a quote unquote product demo, but rather it's intended to sort of be exactly what you've hopefully enjoyed so far. It's a conversation and an inform around what the art of possibility is in the real world of today with this technology. And on this particular subject, just to kind of put a little bit more color into it beyond what Saemica's mentioned so far, this is when it comes to the referrals, which is obviously the lifeblood of the practice, the revenue. It's also an integral part of the practice's relationship within the referral community. The beauty of what all can happen today automatically through automation is receiving that referral, identifying that patient, sending that patient, if they so choose, then a text message letting them know from your practice they've been referred, and then engaging with that patient again through the convenience of secure messaging, the opportunity to schedule an appointment. You just work yourself through this closed loop journey that the patient naturally goes through, but also through automation, providing the notification and the updates back to the referring provider so that that loop has been closed on their side before this patient has ever even entered the four walls of your practice. Conversely, should the engagement happen, reach out to that patient referred, and there is no response or patient doesn't even acknowledge or ever engage with your practice, that same notification of non-engagement can be sent back to that referring provider again, closing that loop and keeping the channel of communication open. Saemica, this is, to me, critical, not just as you called out for getting those patients scheduled, but for the revenue of the practice.
Absolutely. And I'll even take that one step further. Just with the climate of today, we know that, at least I used to always tell my physicians, during the summer months, it seems like our clinic, schedules fall off. Patients call and they cancel. They call you at the beginning of the week, desperately need an appointment. You fill your slots. And then they call and cancel. You see these holes. AI also has that capability to see that those slots become available and utilize a wait list to extend an opportunity for patients that are on those wait lists to fill those slots. Empty slots, especially when I know that all of us as healthcare providers and operation directors, we want our schedules full. You may even have an access problem where your time is 4 to 6 weeks to get in to see that particular specialist, and you want to keep those slots full. When that system's recognized that you have an available slot, it will send it out to a few patients, and it's first come, first serve to fill those slots. So you should always have a plentiful schedule.
Love it. Let's talk about staffing, which obviously is a huge problem. It goes beyond just healthcare, but even for the most routine of support staff in clinics today, we're competing against the local Starbucks or others in retail, even on an hourly wage basis, and those wages are only climbing. So the staff that we have and the staff that can be retained, making sure we're getting the most bang out of that staff, having that staff focused on the most high value tasks, so on and so forth, critically important. Saemica, I know we're really proud of even as simple as the automation around role-based dashboards and task management and so on and so forth. But I'd love for you to be able to share what your experience has been and as it relates to increasing.
Absolutely. So I'll tell you, all of this is nothing new for us. Probably since the pandemic, we know that we are all desperately understaffed. So I'll tell you what I did in a practice, where you're currently seeing, you're having turnover, but you still want to be able to offer your patients a consistent level of care, and still meeting timelines of metrics that you've set forth for yourself, or your clinic's practice. So when we leverage AI, we actually utilize AI across several different platforms. We actually allowed it to actually send out document paperwork for patients so that they can complete it prior to their visit. Once they get that paperwork completed, they're offered to pay their copayment, coinsurance, and deductible or estimate that you have provided to them, prior to even walking in your door. So what that allowed us to do is no longer have that long line at your check-in, because now we have been able to get majority of this stuff corrected through the system. They even have the opportunity to, if their insurance changed, that's no problem. They can actually take a picture of their insurance and it will pull that data into the system. And our team are still able to check eligibility prior to that patient's arrival. So pretty much a patient is able to walk into the door, give us their first and last name and what provider they're seeing, and we're able to check them in. We'll be able to see all the processes marked as green because they have done all of that work prior to coming in. So I'll tell you, in addition to that, there are several AI systems that are out there, but that works around sending paperwork out. What I love about the AI technology and automations that are offered with the NextGen is it becomes something that allows all of us as a whole entire practice to be able to balance out burnout. So now the first part of, we sent out documents to our patients. You can even schedule based on your event type. Let's say you have a vasectomy scheduled. Your provider always want to get a consent form and, maybe some educational information. That stuff can be sent out as well. You can have consent forms signed prior to arrival. In addition, they can go through their past medical social history. That will be blown into the EMR system. So it's not a PDF that your nurses, which is what we normally see. That's where we were years ago. You would get the PDF completed. You had to print that off and your MA or nurse had to go and still index that into the system. That's no longer the case. So now we have been able to help our front end as well as our clinical team. When you help your clinical team, now you become more efficient and you can utilize time better. And that's how you increase encounters. Because once you can have work done prior to, that reduces that workflow. We used to call it pre-charting because you had to sit down and pull records and your nurses or MAs had to write down all of this stuff. Now it's given to us and it's blown into our system. And so we're able to call a patient and get, just prep for their visit and get them directly into a room.
Yeah. So, I mentioned earlier, but just to sort of emphasize this, Saemica, um, this is true omni-channel communication. So this pre-visit example that you describe of the vasectomy, which is just as the entire intake pre-visit workflow, it can be accomplished through the web, through email, and or what we're seeing the vast majority of patients choose is the convenience of secure messaging in a mobile environment on their phone. And they can sign those consent forms right on their phone, but everything they're doing is automatically then sent securely right into that patient's record. There is no need for double entry, which, as it relates to staffing, huge efficiency, but just for the convenience and security of capturing all of that information and not burdening the patient with it when they walk in the door and handing them a tablet, although that's something you could certainly do with us, is has been invaluable. Agree?
Absolutely. I will tell you, like when you're able to automate workflows, patient intake, document management. So that this is, of course, we are the goal was that we're paperless, right? How many of us know we're not all paperless? We get a whole lot of paper that come across these faxes and mailed to us from our providers. There's even where you can use OCR, which is faxing that recognizes characters. So that now does not become a physical task of a person going to pick something off a printer and indexing it. The system is able to pull that in and index it appropriately. And your staff now has been freed up from all of that manual labor. And not to mention the time reduction, the time saved of being able to not now have to touch that many multiple levels of multiple fax. We all know we have a fax in the front desk. You got one for your nurses in the back. Now that becomes standardized. It's all in one kiosk, in one queue, and it gets indexed appropriately to the specific provider. So, for example, if you get the system recognized characters to say, oh, that's pathology, then that would get indexed to that provider and labeled as pathology. So this is the forward thinking that allows us to function day to day without having to increase increase FTEs. When we're talking about how AI help us, AI actually makes us scalable. You know, as we continue to grow, we don't have to continue to add FTEs because your systems are large enough and can stand the capacity of you to continue to grow and you maintaining a certain FTE.
Yeah. On that note, I mean, obviously, our audience is with all of us today because the theme for us is AI and how AI can help these practices. Um, and I have had so many interactions with the actual physicians and providers themselves, and AI is obviously a buzz and has been. And we're going to get to the provider side of how to better leverage AI in just a moment. But the MGMA recently came out with, they had done some survey of their members, and it was interesting. And it's directly in line with what you were just saying, Saemica. 90% of the respondents in this MGMA survey, which was the premise of your quest and your interest in AI is rooted in blank. 90% of those respondents, it was solely around increasing operational efficiency. And certainly everything we've touched on to date is increasing operational efficiency. But when you really start to unpack this with a lot of groups, it comes down to exactly what you're talking about. It's minimizing the burden on staff of having to physically touch and manage faxes and taking advantage of OCR technology. It's electronically being able to streamline and ensure speed around referrals and referral management and engagement with those patients, broadcasting messages to those patients the way that patients want to be communicated with, which for many, including the greater than 70-year-old population is with the convenience of text messaging, so on and so forth.
Absolutely. It's definitely a patient satisfaction, increaser. It's a pleaser. I remember one of my physicians, when we added self-scheduling, we turned this feature on, and we started with one or two event types. We didn't want to, I think we started with new patients. We didn't want to do procedures just for our own, we wanted to be able to manage it one event type at a time. And what I quickly recognized was patients want to schedule. Like they do it on their own time. We came back into the clinic after turning it on for one night, and I had 35 new patients that were on our schedule. So, but that was super impressive to see, just because I think I might have turned it on like 4:30 or 5:30 that evening, because I had to finish get it set up. And I came back into the clinic that morning with 35 new scheduled patients. So your patients want this flexibility that these systems give us. They like chat boxes. They like responses and I'll tell you, to talk through AI chat box, that's a whole nother love for me. I think when you build AI chat boxes, that takes some of those phone calls. So now you're helping your call center, because how many patients call us just to see, do your doctor see, a 17-year-old? Do your doctor, you have anybody that specializes in robots or fertility? You can build these answers, and it continues to learn from you in chat boxes. So your patients can get all the answers they want just by communicating with your chat box. So we've seen a significant reduction of just call center phone calls coming into the clinic.
Yeah. So there's the chat bots that you just mentioned, and how that can be handled. And all of this, it all runs under lots of different names. We refer to it as digital call deflection. So it can go even further. And again, all in the spirit of multi-channel communication capabilities, allow for that patient who's calling to confirm their appointment time, and or calling to confirm the address of the clinic, so on and so forth, allowing for them, which totally frees up the actual human call center to have the opportunity to route to a text messaging capability. So the example that's most, if you're not familiar with this technology, which obviously is fully integrated into NextGen, the example I often give, I happen to travel a lot. My preferred airline is Delta Airlines. So whenever I call or have a need to call Delta, I'm immediately given the prompt before I can get to a human, where I have the option to engage via text message. We offer the same capability, and it is immediate, purely AI driven, and done in a secure fashion that can even allow for that technology to know what patient it is that they're interacting with and what time their appointment is. So if you haven't seen how these sorts of solutions around patient access and patient engagement can perhaps bolster and help your own organization, I'm super excited for you all to see it.
Absolutely.
Let's talk about AI for physicians. So NextGen Mobile, wholly owned platform of ours, which is truly the bellwether of the physician's interaction today with the patient record, is a huge part of who we are and what we've believed for a long time. And part of that belief is that our premise has been that voice should become, and in fact now has become, the primary input device for the physician, meaning no longer pointing and clicking themselves through templates and or having to physically type and or press a button on a little handheld device that is essentially a mic that they then dictate into. It's just the conversation with their patient in the exam room in a natural fashion, as if they weren't having anything in between them. And that is where AI has taken this. Of course, if you're not familiar, what I've just described is known as natural language processing. Some instances, it's known as ambient. For NextGen, it's a part of our mobile platform, and we call it Ambient Assist. Saemica, I would love, and I can extol on and on about all that this can bring, but I'd love for the audience to be able to hear a little bit about your experience with this as it was deployed for you with all of your physicians.
Absolutely. I'll be honest, I was super excited about this platform when I first heard about it. I actually had the chance to actually do a role, and I actually played a physician. So I even had a short talk with the demonstrator, and because at first, what we all remember this AI system that stated it could do all of these things, but then you had to copy paste it into your EMR system. So of course, I went into it, super excited. But what I learned was this system was actually actionable. We were able to take a telephone, and I put a telephone in between me and this demonstrator, and I watched my physicians do this very same thing. And so when I saw what it gave my physicians when we brought this into the clinic, I actually was super excited because I felt like it gave the patients back their physicians. The phone was on the table in the middle of them two talking. There was conversation in reference to, the kids in college, how are your grandkids doing, all of that. The system was intuitive enough to prepare the social, medical, pass, and your SOAP note, and even give you an opportunity to choose, because it kind of summarize like your coding. After it gives you a narrative note, it kind of suggests codes for you. So again, super excited about what that allowed our providers to do, even all the way down to I had one. I think when we first deployed this, what we actually end up finding to be the best for us, because physicians like to draw. So we saw that we were able to use mini iPads that actually worked a little better for us within the clinic, because he could now still make this a little live, pull out a notepad and still draw on this system while it's continuing to talk. But there was nothing in between my physician and the patient. And we were able to get a very, clear narrative note. And then you could push a button to tell it to go to your EMR system. And so then, of course, providers said, well, what if I want to change something? That's fine. You've just pushed it into your EMR system. You can still go when you're getting ready to tidy up your note and add, into the direct desktop of what you want to add into that. So that did not stop our physicians from being able to add later. What I end up seeing happening is, because when we first started, like, everybody's scared of change, right? So I had the doctors to start with new patients. The reason I wanted to start with new patients first is because that's when you're getting all this history. So that's when you're going to prove the system works, right? Because now you have a new patient, you have to talk through what they've tried and failed. How long has this been happening? So it becomes a big, broad set of questions. You may be even reviewing imaging intake or pathologies from previous providers. All that's going to be in that system. So when we were able to produce a narrative note that they were pleased with after seeing a new patient, I knew I had them sold. Okay. But what I'll tell you in addition to that is these providers now were able to not spend what I used to see is probably an hour or two at the end of a day. And just because I can see open charts, I know that they completed those charts. What I say after I put my kids to bed, now I'm going to go work another hour or two to close all of my notes. That time goes away because now you have made the work within your business hours. You've scaled it back to, I'm dealing with this patient, I'm able to see this note, and you trust the system. In addition, I will say, how you all have your acronyms that maybe no one else know but you, what that means. You can actually tell the system that if I say turkey, that means, that's my vasectomy note, and this patient has had blah, blah, blah. You can build additional macros into the system to help you even with speeding up your dictation. So was super impressed with ambient AI. I will even go a step farther to talk about when you are talking through, I am going to prescribe. a patient, uh, Valium. I am going to order my labs. It tees up those orders, you know? And so that's when I say actionable, that's what I mean. It's not a system that you have to continue to tweak and you got to go back in and you got to copy paste it and move it to make things work. Once you're able to have that visit with your patient and see that full note, you can actually, and then several of my physicians have been able to close notes very quickly within the system. I actually have one funny story. So I have one physician who we actually saw a significant improvement on denials. And the reason we laughed at this is because I said, man, it's the same visit. Like, what's happening? In his exam, he explains and talk about all of that. He just don't document that they tried and failed this. He said, okay, you failed that. And so we're going to try this new drug. He write a prescription for the new drug. So now I was able to catch what they tried and failed because someone else was listening to him. So of course, what I told him is, you've been needing someone to listen to you because you have great visits. You just don't document it well. So I love the fact that several things. It prevents providers from being burnt out, and it gives you suggestions of coding. And sometimes what it'll actually even show you is something that what we're seeing in healthcare every day is several codes are being inclusive of another code. It kind of suggests those things. It tells you like, hey, this is what it's, what we think. And so I think it actually makes, this is what I say, it makes great doctors better. Like it actually makes you think through things and you actually are able to see things. And I think when I say better, it's teaching you coding, where before we only had to rely on your coders or AI technology that we would add into the scrubbers. It gives you that knowledge of why you're coding things a certain way.
Everything you just said, which truly are your own words, but it is real. And this for me um, is what I've been so excited about. It is, I would suggest, the most transformational technology in healthcare to date. It's moving fast. I'm incredibly proud of how far advanced NextGen has come on this journey with AI for the physician. Um, and we've done it pretty deliberately. We've been careful about this. Um, some additional features that are a part of all this workflow that are so invaluable is an AI generated summary of that patient's history. Again, this is an iOS solution we're talking about, as Saemica mentioned. So we see just as many physicians using this truly in the palm of their hand via a phone as we do via an iPad. Obviously, the real estate size of screen on an iPad is tremendous. But giving you that AI generated summary before you even walk into the exam room, it's my description, but think of it as like a wiki of that patient's history before you present yourself inside the exam room. Invaluable. To Saemica's point, capturing all of that conversation, discarding all of the non-relevant conversations. So talking about the golf game this summer or the weather or the family vacation or whatever it may be, it's capturing it, but then discarding it when it returns immediately after that visit, the full structured visit notes, and then capturing those orders to include the drugs, all there to be reviewed, edited on the fly if you want, via the phone or iPad, or giving you the flexibility to go clean anything up afterwards. The time savings that our providers that are using this are seeing are significant and they're real. What you want to do with that time savings obviously is up to each provider and organization to determine on their own. But I have literally had physicians tell me, I now get to go home earlier, spend time with my family, and not have the burden of finishing all my notes after dinner. And I've had other providers with excitement talk about how they are seeing more patients throughout the course of the same day because they're freed up from the time. So lots of different ways that this can get cut, but it is incredible and is fully integrated. So there isn't anything like copy and paste, as Saemica mentioned. There's a lot of this technology out there, obviously, but all of it being on one platform is huge. Saemica, we're going to get to some Q&A here in just a little bit, but I want to talk through a little bit the another one of these levers, and that's around cost containment. I would lump into that just as much insights, analytics, the ability to provide an organization, folks like yourself, within senior leadership of organizations, the ability to get real-time analytics on your AR, to get real-time trends on denials. The list goes on. All of this, again, leveraging automation. I'd love for everyone to get a little bit more perspective on what the power of all of this was for you.
Absolutely. I'll be honest, when I first got into AI, I got super excited. And so I started recognizing like right away that, as we are adding these different platforms, I recognized my providers were being more efficient. So I started seeing, some double books, some work-ins, doctors asking me to change templates to allow additional patients. So I recognized that for one, it got us more efficient. Never did I have to add additional admin staff or additional clinical staff because now we have utilized the system to help with a lot of that work. What we've actually looked at as far as like eliminating and reducing denials because of clean claims, that was significant for us. There, of course, are payers that rules are ever changing. I actually joke with my RCM leads and say, like, every quarter they give us some new rules to follow. So when those things happen, you're able to, now add those things into a revenue cycle bot to help with some of these rules that we're trying to keep up with. So I look at the costs being the real cost saving is us being more efficient, so we're able to see more patients. Our notes are better, so we're able to collect on things. We are all of our services. Prior authorizations are captured, so we're able to make sure that we're not getting a denial just for us not remembering or adding a prior authorizations. So that's what makes us, when I say big picture and whole clinic, overall be more efficient, that ultimately results in cost savings and additional additional revenue is what I experienced with us adding AI into our facilities.
Goes without being said, but obviously, the role that a company like NextGen Healthcare and all that we have been discussing and all that we offer to our clients, which is integrated and integral to the EMR and the practice management side of a business. We're not controlling the general ledger. There's only so much dependency upon a company like NextGen or your healthcare IT vendor upon your general ledger, but giving you the insights and the analytics, as Saemica was just mentioning, into your performance, being able to drill in and have, which all of this is available with us today, to have the capability to see provider productivity, to see how much time providers are spending in patient chart during exam, having the ability to get insights on no-shows, and the logic around how that can be actionable. All of this is so powerful. And it's why I get excited about not just the coolness of technology, but rather truly having an impact, and being able to truly provide value, and a return in improving the business, the efficiency, the operations of our clients. It's why I'm here. It's why we're here. It's not just to have a new shiny object. which is kind of an easy segue for me to before we get into Q&A. Just again, shameless self-plug, but it's why we are here. I'm hopeful that this has been fun and informative for all of you. And I'm, as you heard, super proud of what we've been able to build at NextGen, and specifically what we have that is tuned so well for the high volume urology practice. And again, it's all on one single database, a fully integrated solution, not all of these disparate solutions solving for all of these complex problems separate from one another. This is one thing. So with that, we do have some of our friends in the background, behind the curtain, virtual curtain, if you will, that have been hopefully receiving some questions. I know I've been seeing some pop in off to the side of my screen. If you have a question and you haven't submitted it, please do. You should see on the screen in front of you the means with which to do this. And I'm going to ask Nicole to go ahead and start firing away with some questions for Saemica and I, if you could, please.
Yes, of course. Yeah, we've had a few come in. So first question, what is currently the best way to integrate AI into delivering more efficient care for patients?
Yeah, so I'll be honest, I think it depends on what your clinic needs are immediately. I think if you are, so in other words, if I think it's a kind of loaded question, I think if you are recognizing that revenue cycle collections are an issue for you, then I would start at, pre-collection. Then I would start in integrating, systems that embed patient forms, consent forms, and also capturing that personal PHI information, as well as social, medical, family history. But if it is right away that you are seeing that your doctors are exhausted, they are spending more time in the clinic than what you want to see them after clinic or at home, then I would say focus on your physicians first and get them feeling comfortable with the system, integrating ambient AI technology. Because what I'll tell you is I always say at home, they always say happy wife, happy life. In the clinic, it's happy physician, happy life for your operations leader. So if you are recognizing that within your clinic, it's starting with your physicians, then I would look for solutions for them. And then in addition, collections is always going to be, from an operations standpoint, the first angle that I approach, which that's why that was the first level of technology that I involved ourselves in, was also around pre-collection revenue cycle, chat box. And I also look for scrubbers, so that's why I did like the RCM technology, AI technology, because when you are part of a private practice, you don't have the levels that you have in health systems. You don't have the number of bodies to keep up with that type of claims that are coming back in, or rejections or denials that are coming back in. So for me, it was pre-collection and then RCM. And then I focused on my physicians, and then we leverage ambient AI.
I couldn't answer it better. Next question, Nicole.
The next question is, does AI interface with the EMR?
It absolutely interface with NextGen. And I will tell you, every piece of this AI technology that I've talked through this presentation all integrate into NextGen and make one happy system. One piece that we did not talk through, of course, is like virtual visits. But I will tell you, their platform for virtual visit is probably the best that I've seen. And the reason I say that is most platforms, you are having to go out of a system. Well, that's most EMR systems. I give NextGen this credit of fully integrating these partnerships, because what you normally have are isolated fixes. So you have multiple dashboards or platforms separate from your EMR system. All of this is accessible within the NextGen EMR.
All right, next question. is there any role for using Epic EMR to implement some of these ideas?
I could take that, Saemica. Sure. Epic has some AI solutions. I'm a big fan of Epic. As I'd said early, we are an ambulatory only platform. And so by that nature, we have and are a very good trading partner with Epic, meaning communicating, allowing for our clients to be able to seamlessly and easily communicate with the Epic systems within your local communities. But everything that Saemica and I have been sharing with you, the stories of real world applicability that Saemica has been sharing, and the solutions that I've been discussing, these are all a part of the NextGen ecosystem, all a part of the NextGen platform.
All right, thank you. Next question. What platforms do you recommend for ambient technology?
NextGen. And more specifically, NextGen Mobile. So Saemica had mentioned partnerships, and we certainly, running our business. When you're in the technology space, you have one of three options. You can build something, you can go buy something, meaning acquire, or you can partner. And we are very selective. We've been a serial acquirer of companies. I actually came to NextGen by way of an acquisition. I was the CEO of a company NextGen acquired 8 years ago. So we've acquired a lot, to include our mobile platform, which was quite some time ago, and it's the foundation and the footprint with which we've grown this. But even for those technologies, in that mobile platform is what powers our ambient. But even for those technologies and solutions that we partner with, we're extremely selective about who we partner with. And when we partner with something, it is then, we believe, incumbent upon us to fully integrate that partnered solution, meaning that for the end user, it is presenting and feeling and acting as if it is truly right in the NextGen ecosystem. Now, we reserve the right to swap out partners, and we do from time to time. But again, that burden that is on NextGen, one we take very serious, that when we make that decision to swap a partner out, we can swap one in and the other out at little to no impact to the end user. So that is quite different than some of our competitors. Some of our competitors have incredibly large marketplaces, and the burden is on the client to go cull through and select amongst a whole literal grocery store of partnered solutions to what maybe might be best for them, so on and so forth. That's just not the path we've taken.
All right, next question. What's the best starting point for implementing AI if our practice has limited resources?
Yeah, so I'm sharing a QR code on the screen in front of you, along with my own personal mobile number and my email address, and you can see Saemica's contact information as well. And so please feel free to reach out to me, and I'm happy to help connect. That QR code is going to direct you to more information about NextGen, and again, very easily allows for you to get more information. But the short of that answer is, we would love the opportunity to talk and have a conversation around what we're doing, what this looks like, and as a part of that, would easily be able to share and show how we could help you take advantage of everything we've discussed today. What time for one more question, Nicole?
All right, last question. Is there a risk of over-automating tasks that should still involve some human touch?
Saemica?
So I'll be honest, at the moment, I have not experienced that. What I would tell you is, within the NextGen system, all of these AI tools, and I think this is why I love the fact that NextGen invests in the partners, in the partnership, and fully integrate. So when you're within one system, there's no overlap where you're concerned about technology bumping up against another. They all work within that same space. So so I guess the short answer is, if you're pulling in AI technology outside of your current EMR system because it's not fully integrated, then the answer is probably yes. Within NextGen's platform, you will not see those problems become anything that you're concerned about. What I would also state is NextGen actually do the work for you to make sure that we are integrating into these practices. We talk to the right people to make sure of what things you're seeing as far as day to day, and we vet out these partners, which is why they're selective of who can be a partnership. And that is because we want to make sure that all of the AI technology works well within the same ecosystem.
One of my firm beliefs, and on that note, is, and it's one of my favorite sayings: nothing important happens in the office. Nahito is how I refer to it, and it's a part of the pragmatic school. And we truly believe that. So at NextGen, to Saemica's point, engaging with our clients. That's why I spend so much time with Delta Airlines, getting out and meeting our clients where you are and having these conversations and vetting out our roadmaps and our products with our clients is a huge part of what we believe, and it's at our core. And so, again, I can't thank you all enough for joining. We would welcome the opportunity. My sales team would welcome the opportunity to have to get to meet any of you. The QR code is there. My information is there. I know we only got through a handful of questions today. So even any other questions that you all may have, please feel free to send them to us. As is always, our friends at AUA will have this posted on demand. So if there's something you want to capture, that will be available for you as well. And lastly, Saemica, thank you. You're wonderful.
You're welcome.
I appreciate getting to do this with you. Hopefully this was kind of fun. It was fun for me. And with that, I want to thank all of you again for joining us. Love to have a conversation with you more.
Thank you all.